Hello and welcome to part 2 of COVID-19 and osteoporosis. This is our question and answer section. We have a number of questions that have been sent through to us from our consumers, and I'm delighted once again to be joined by Professor Richard Prince, consultant endocrinologist. Welcome again, Richard.
Thank you for asking me.
The first question is, I've heard that some medications render more susceptible to poor outcomes of COVID-19. If one is unfortunate enough to have the disease, does this include common medication given for osteoporosis?
The good news is no. Just before I came on today, I checked the world information on COVID-19 and the various disorders, and there's no mention by anybody of any problems with osteoporosis medications. However, as we'll discuss in a moment, there are some important messages that you need to understand because of COVID-19.
Thank you, Richard. Our second question deals with bone mineral density. Should I keep up my routine bone mineral density checks? Are the scanners still open for non-urgent appointments?
This is a very commonly asked question. As I understand it, all the radiology facilities have on their website a statement that they are open for business. They've all changed the way they do business with hand cleaning and distancing. And so the risks in Western Australia in particular are extremely low. The risks of you missing out on the correct treatment for your osteoporosis are now beginning to be much higher than the risks of getting COVID-19 through bone density testing and also pathology testing. They've changed their habits, just as we all have. So I think in general, we've done a good job. So the risks of not looking after your chronic disease are now higher than the risks of getting the right tests.
Thank you for that response. I have another one here from one of our consumers. I'm 73 years old and have osteoporosis. I have decided to take a holiday from exercise whilst I can no longer attend my usual face-to-face exercise class. How long of an exercise rest can I take before my bones start to show signs of thinning?
Well, first of all, thank you for the question, whoever you are. I too, not infrequently, take a bit of a holiday from my exercise, so you are not alone. The question you asked, how long is the holiday? Well, not long. For example, if you've had a fracture and the bone is put into a cast for 6 weeks, there's demonstrable bone loss. And because our bones the cells are getting a bit old, we often don't completely replace it. So the truth is that we should all try and exercise every day, not only for our bones, but for our heart and also for our head. Exercise is demonstrated to be good for anxiety and stress.
Thank you for that, Richard. Just moving on to the next question to do with medication. The question is, the medication guide for Prolia mentions that it affects your immune system and people who have a weakened immune system may be at risk of developing serious infection. Are there any studies which suggest that persons on Prolia do have a greater risk of infection such as respiratory, pneumonia or influenza?
Yeah, this is a good question. Congratulations for reading the consumer medicine information in detail. It's written by companies and governments who are risk averse. So they do tend to overemphasize the risks. The controlled trial data is that there is a small increased risk of skin infections. The medication actually is sort of affecting the immune system. The osteoclast is a very specialized immune cell. So there's a theoretical basis, but in the huge studies that have been done, there's been no real evidence of increased risk of infection in immune compromised patients. So it's a theoretical risk. There's a small risk of skin infection, but otherwise, no. Missing the medication increases the risk of your fracture much more than it reduces your risk of COVID-19 infection.
I have another question here. Are there any drugs in the pipeline without side effects?
Unfortunately, no. Nothing in life is only good effects. So the way drug companies and authorities look at it is the balance between benefit and risk. So, for example, cancer drugs have far more side effects than osteoporosis drugs because the disease progression is so severe and the balance is much in favor of using drugs that do have side effects. Now, the big important issue that this great question addresses is, what is the natural history? What is osteoporosis about? As I tried to show in the presentation, it's a slowly progressive slow disorder, and if you stop treatment at 10 years, it'll just come back. In fact, it'll come back with a vengeance because you've stopped it for 10 years, and then the skeleton suddenly decides to become 10 years older. So the current view is that you can't stop Prolia. The studies have gone for 10 years so far, but the current thinking is that if you stop, then the bones disappear very quickly, which is one of the major points I was making in the presentation. Now, this is different from bisphosphonate treatments, where those drugs do stay in the skeleton and continue to have an action for a couple of years after you've actually had the last dose. So there's a big difference between the way these two drug classes work, and so changing or thinking about not taking Prolia needs careful advice.
Thank you again. Is it still recommended to take a calcium supplement for osteoporosis? If so, what amount and type is recommended, Richard?
Yes, another surprisingly controversial area. We thought this was all signed, sealed and delivered 5 years ago, until some of our colleagues began to question the data. Now, the specific concern that was raised is that this calcium increased the risk of heart disease. Now, all the international authorities, while recognizing this question, have on balance said that if you get more benefit from calcium, you should continue to take it, because the data that it increases heart disease is not very good at all. Even the individuals who have raised these concerns strongly agree that if you're taking medications to rebuild your bone, it's important you take calcium and vitamin D to make sure that they get mineralized again. So it's really important to take calcium and D if you're on medication. If you've already got low bone density osteoporosis, then the risk benefit is in favor of taking calcium and vitamin D. How you take it is in diet, preferably. The problem is that it looks as though you need about 1,300 milligrams, which is a litre of milk a day. Now, that's a lot of milk. So most of us are really only taking around about 600 to 800 milligrams a day. So if you really need it, you should seriously consider a 600 milligram calcium supplement. Now, there's no shortage of those at your pharmacy. You go into any pharmacy, pick the cheapest that gives you the 600 milligrams of calcium. The other things that are suggested are interesting, but the data is nowhere near as strong as calcium, and they are more expensive.
Thank you once again, Richard. We have one final question. It's from one of our consumers, which says, I have lost 8 kilos over 10 years due to a healthier diet and active lifestyle. My most recent bone scan was done last year. How does my weight loss affect my bone scan results done 10 years apart?
The thing we all know is that losing weight and keeping it off is hard work. So congratulations on keeping it off over 10 years. It's the best thing you can do for your heart is not be overweight, because the fat is not only around your tummy, it's also in your arteries. So the question you ask is actually really interesting. The bone density machine actually allows for the amount of fat outside the bone. So in general, the weight loss does not directly affect the bone density value. However, dramatic weight loss, for example, in bariatric surgery, is associated with bone loss, but that's an effect of the weight loss itself. So if there has been a change in your bone density, that means that the cells eating the bone have been more active than the cells forming the bone. You can still treat those two cell types on their merits with diet and exercise or medications as recommended by your doctor.
Thank you, Richard. That concludes our Q&A session, part 2 of COVID-19 and osteoporosis. I'd just like to say thank you, Richard, for taking your time to come along and be part of this webinar, and your support for the foundation. Once again, thank you very much. Bye for now.
Much appreciated. Thank you.